Percussion of the lungs, Part 1. Position of the patient. The sitting posture is the best choice for percussion. Anterior percussion. The patient sits erect, with the hands by his side. Posterior percussion. The patient bends his head forwards and keeps his hands over the opposite shoulders. Lateral percussion. The patient sits with his hands held over the head. Cardinal rules of percussion. The plexometer is the middle finger of the examiner's left hand. The plexor is the middle or the index finger of the examiner's right hand. The percussion movement should be sudden, originating from the wrist. Proceed from the area of normal resonance to the area of impaired or dull note, as the difference can be easily appreciated. Method of percussion. The plexometer is apposed tightly over the chest wall, over the intercostal spaces, while the plexor is used to hit the middle phalanx of the plexometer. Comparative percussion. This method is used to compare percussion sounds at identical places on both sides of the chest. Its usefulness lies in detecting asymmetrical findings, indicating underlying pathologic process rather than the sound or note itself. Topographic percussion. It's useful for outlining the borders of organs like the liver or heart. Areas to be percussed on the anterior chest wall include clavicle. Direct percussion is done within the medial 1/3 of the clavicle. Supraclavicular region, also called chronix isthmus. It is a band of resonance, 5 to 7 cm size, over the supraclavicular fossa. The percussion is done by standing behind the patient, and the resonance of the lung apices is assessed by this method. Infraclavicular region, which lies below the clavicle and above the 3rd rib. Mammary and inframammary regions. 3rd to 6th, intercostal spaces. Here, the percussion note cannot be compared due to relative cardiac dullness on the left side. Areas to be percussed on the lateral chest walls include axillary and infraaxillary regions encompassing 4th to 7th intercostal spaces. Areas to be percussed on the posterior chest wall include suprascapular and interscapular regions, which lie at the level of 1st to 7th ribs. Infrascapular region, up to the 11th rib. Types of percussion notes. Resonant sounds are low-pitched, hollow sounds, heard over normal lung tissue. Tympanic sounds are hollow, high drum-like sounds and normally heard over the stomach, or hollow viscous. Crackpot resonance. A type of tympanitic note, which can be produced by clasping the moist hands loosely together and striking it against the knee. It may be elicited over a large cavity, communicating with a bronchus. Subtympanic or scodaic resonance, or boxy quality sounds, are heard above the level of pleural effusion. Hyperresonant sounds may be heard in pneumothorax, asthma, and emphysema. Impaired resonance may be due to pulmonary fibrosis, cavity with surrounding fibrosis, as in TB, or malignancy. Dull sounds. Dull sounds were described historically as woody in quality. These are normally heard over dense areas, such as the heart or liver. Dullness replaces resonance in conditions such as pneumonia, pleural effusion, consolidation, collapse, pleural thickening, pericardial effusion, or tumors. Dullness in the apex of the lung might suggest Panco's tumor or tuberculosis. Stony dull sounds may be heard in pleural effusion, empyema, and parenchymal lung disorder with pleural thickening. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.